Hello everyone, Dr. Medina here again, continuing our discussion on gut health in healthy digestive function. This is video 3. Let's get into it here. All right, so if you didn't get a chance to watch video 1 or video 2, definitely go back and watch those. They're short videos, but they go into more depth into the beginning phases of digestive function. We're going to continue our conversation into a little bit more on the liver and the gallbladder and then the pancreas itself, okay? So last time I didn't mention kind of more common signs and symptoms of a possible liver gallbladder issue. So I want to show you guys the assessment form here. We have all our patients fill out at our initial consultation so we get a better idea of what kind of symptoms and organ systems might be getting affected. So if you see here, if you can direct your attention here, category 8 here, and category 9, these reflects function of the gallbladder and the liver. And you can see a lot of these symptoms revolve around greasy or fatty foods cause abdominal distress, bloating, or feelings of uneasiness, lower bowel gas or bloating after eating, burpy, fishy taste after consuming fish oils, bitter metallic taste in the mouth, unexplained itchy skin, um, reddened skin, dry or flaky skin is a common one because, again, you may not be digesting and absorbing healthy fats in your diet, which cause dry skin, flaky hair, and things like that. And of course, having a history of gallbladder attacks or stones can be an indication of possible sludge forming already in the gallbladder. Now, category 9 here refers to function of the liver. You can see here acne and unhealthy skin. Okay, now it doesn't also always have to be acne. It can be weird skin allergies, things like eczema, psoriasis, things like that, that maybe don't respond well to topical steroids or medications. Excessive hair loss, overall sense of bloating, bodily swelling for no reason, hormone imbalances, which we talked a little bit about in the last video. Because remember, the liver and the gallbladder are responsible are organs of detoxification and responsible for metabolizing and excreting excess hormones. That's especially important for women who have large hormone fluctuations throughout their cycle, but also because of the prevalence of use of birth control, right? Birth control, you're putting more hormones into your body. And if your liver and your detox systems are not properly metabolizing and excreting that, then it's going to cause a buildup of hormones in your system, okay? And excessively foul smelling sweat. Okay, so those are the common signs and symptoms. So when we have patients fill these forms out and we see lots of 2s or 3s kind of over here, that means there's a high probability they are having some sort of liver gallbladder issue. But remember, liver gallbladder issues are also dependent on having healthy stomach acidity. Again, we're not going to get too much into depth of that. If you want to learn more, be sure to watch video 1 and video 2 regarding that topic. Now, let's talk a little bit about the pancreas. The pancreas is another organ system vital for digestive function. In addition to secreting insulin, which helps manage blood sugar and get sugar that's in the blood into our cells, the pancreas also secretes digestive enzymes. Now, digestive enzymes are also a supplement you can get over the counter, usually labeled as either pancreatic enzymes or digestive enzymes, that you can take to help digestion. Now, a big sign that you may have a pancreatic enzyme issue is inability to digest carbohydrates very well. If carbohydrates cause you some minor bloating or indigestion, that is a possible sign the pancreas isn't secreting enough enzymes. Okay, but again, pancreas function, liver function, gallbladder function are dependent on healthy amounts of acid in the stomach. So we always check upstream to see if there are signs and symptoms of a possible low stomach acidity issue, which is causing downstream issues. Okay, simply just giving either pancreatic enzymes or giving biosalts to help with gallstones isn't necessarily going to fix the problem. It may give symptomatic relief, but if the root cause of the problem is low stomach acidity from either an H. pylori infection that we discussed in video 1, or overconsumption of processed carbohydrates, or overconsumption of maybe grains that you're allergic to, then you're going to continue with issues until that root cause is addressed. All right. Thank you very much. Stay tuned for the next video where we discuss more on healthy digestive and gut function.